Hey, Tim Reha here live at Digital Health Summit 2013 in beautiful San Diego. We have a really interesting session that just came off stage, which is a day in the life of doctor, patient, and caregiving. Marianne Braunstein, who's the VP of Product Management for Epocrates, is here in studio. Hi.
Hi, how are you?
Good, great day. The sun's coming out.
It's beautiful, beautiful.
So what is your background?
I have over 20 years of experience in healthcare IT, so really applying technology to the healthcare industry. I worked many years in a startup company around electronic medical records, joined the forces at GE, and about a couple years ago joined Epocrates, really where not only are we taking those technologies, but specifically mobile technologies, and making them applicable for the healthcare industry.
So tag this video with #M Health if you're out there tweeting, and tell us about the company.
Epocrates is a company that provides just a plethora of clinical decision support and reference tools for physicians. 1 in 2 physicians in the United States use Epocrates daily, and we have over 1 million clinical users worldwide.
Amazing. So it's so interesting to meet people like you. And what happened inside?
You know, really it was a great panel taking a look at what are some of the challenges that are faced by providers. So that's kind of the space we're in, is solutions that we can provide to those physicians, to patients, as well as caregivers. And what are some of the things that are happening in the industry with technologies to really enable them to address some of the challenge that they're facing. And so basically each of the panelists, myself representing kind of that segment for physicians, but we had other panelists representing the segment for patients with chronic diseases or elderly patients, or some of the kind of sweeping technologies between connecting patients with physicians presented. It was great.
And it seems like we're just going through a paradigm shift, a storm of new technology. I know people just in general, like, how do I keep every my passwords? How do doctors in the office deal with this inundation and really deliver the best results for caregiving?
Well, you know, I think physicians are really struggling right now because, you know, our healthcare system, there's just so much pressure on them to see more patients, information that's being tossed to them continuously. And I think so what we have is how we can actually bring technology in where we're not forcing it upon them. You know, I think we're seeing some of that happening right now in the electronic medical record industry and some of the government mandates, which I'm not saying it isn't the appropriate thing to do, but it's a hard cultural change for them to switch to. And it's really about how do we can bring in some of those technologies in a way that's meaningful, that matches what they need. So in our case for Epocrates, really focusing on the fact that they're mobile professionals, very, very mobile. They're making critical life enabling decisions multiple times a day for their patients, and they're very time pressured. You know, they've got patients that are waiting for them. And so how do you bring all of that together and bring technologies that aren't getting in their way, but helping them through to make sure that they're back to the practice of medicine with their patients?
Yeah, so we hear a lot, especially with like Steve Jobs, is how do you make technology transparent? A lot of networking going down here. We just had Anon Iyer and, you know, whole WellDoc team here. What types of folks are you trying to connect with?
Really, you know, I think one of the things that's helpful is to understand kind of at all levels in the industry. So whether you have United Health, you know, that's, you know, the bigger payers and looking at what that involves. Physicians directly, you know, I always love to be able to connect directly with our physicians and understand, you know, what their pain points are, how things are changing, what they're seeing in the industry, and also tapping into some of the other players, some of the other vendors that are bringing great concepts to the market, and patients too.
All right. Well, hey, Marianne, thanks you so much for your time. Very excited, and thanks for coming down to the Digital Health Summit.
Great. Thank you very much.